Uh,
Hello,
Hello,
I am Dr. Bishas. I am a doctor of this clinic. May I confirm your name and age, please?
I am Mr. Ahmad, 38-year-old.
Nice to meet you, Mr. Ahmad.
Nice to meet
I
you.
got a letter from your GP saying that you have some racing and pacing of your heart. Is that right?
Yes, correct.
So I'm going to talk about your condition, and during our discussion, I may take some note, but all the information during our discussion will be remain confidential. So is that okay for you?
Okay.
So can you please tell me in your own words what is happening with you?
Uh, Doctor, I'm suffering since like 4 months. I I don't know. Maybe it's related to my work. I have a lot of stress at work that I'm getting angry very easily. I I I I get angry and everybody commenting around me that I'm getting angry very easily, and I feel that some light heading, and I have light racing of my heart.
I'm sorry for that. And can you tell me that you have racing of your heart for the last 4 months, or did it happen before?
This started for months, and it is coming frequently nowadays.
Okay. And can you remember that before the first episode, did you have any other abnormal events?
No, no, I was totally normal.
Okay. And can you tell me that what do you mean by racing of your heart? Can you tap me out? Can you show me by tapping out with your finger?
It is my heart going very fast like this.
Okay. It is fast. And is it regular or irregular?
I think it's regular.
Okay. And when it start, how long it persists?
Maybe 5 to 10 minutes.
Okay. And how frequently do you feel this? Like in a day or in a week? How frequently?
It was very rare, maybe 2 times per week. But later on, nowadays it's coming daily.
And do you think that the duration is also increasing, or duration remain the same, like 5 or 10 minutes?
I think it's progressing. It's coming more.
Okay. And can you tell me that before the onset of this racing of your heart, do you feel any pre-effect, or can you assume that something is going to be abnormal with you, like any warning shot?
No, it starts suddenly, but I feel that time that I'm going to die.
I am sorry for that. And when it start, can you remember that? Do you feel any chest pain,
There is some chest tightening, but not really pain.
any shortness of breath?
Uh, uh, I was a little bit restless. I don't know if I can call it shortness of breath.
And any do you feel any dizziness during that time, like any falling
Yeah,
down?
I feel a little bit dizzy.
And have you ever fall down?
No,
Have you ever lost consciousness?
no.
Okay. And during the feeling of this racing, you have you noticed that you are feeling shakiness of your body?
My friend comment in my hand that I have some chickening of my hand.
Okay. And when the racing went away, did it persist?
No,
Okay. And have you ever lost your consciousness?
no,
Have you ever noticed any pounding in your neck?
no.
Okay. Do you feel any nausea or feeling of throwing up?
I have nausea during that time, but after that it was
Okay. And when you feel the racing, do you feel any pain in your tummy?
no, I don't.
Any headache?
Uh, I have a little bit headache.
And when the racing persists, or another time also?
It stay for some time, then it goes by. I take some paracetamol and it resolves.
Okay. And have you noticed that you feel hunger during that episode?
No.
And have you noticed that anything makes this condition better, like any activity,
No, nothing in specific.
any just holding the breath or taking some ice or anything else?
No, non-specific. But I went to my GP. He prescribed to me uh, some tablet called bisoprolol, but I don't feel that it helped a lot.
Okay.
He advised me to reduce my use of coffee and tea, but also it doesn't help a lot.
Okay. And have you noticed that after the racing of your heart go away, do you feel totally normal or do you have any after effect?
Uh, I have some headache, as I told you. Then it resolved gradually.
Any
One
increase?
time, I
Yes, please.
one time when I go to my GP, he told me my blood pressure is raised also.
Okay, I can understand. And can you tell me that have you ever noticed that during the episode you are you are changing your colors or you are becoming funny colors?
My friend told me that I have some pallor and some flushing of my face.
And you said that you haven't ever lost consciousness.
No,
Okay. And I am coming to your headache. And can you show me that where do you feel the headache?
it is all about around my head.
Okay. And when the racing of your heart goes, do you feel better?
Yes, the headache you mean?
Yes.
It goes gradually.
Okay. And can you tell me that do you feel any headache in the morning?
No,
Any have you noticed anything that make your headache worse, like coughing, sneezing, or bending forward?
no,
Have you noticed any changes in your eyes?
no,
Any changes in your vision?
no,
Any reaction anywhere in your body?
no.
Uh, how about your appetite?
Nowadays, يعني it, I'm open to eat. I'm eating too much.
And can you tell me that how have you noticed any changes in your weight?
Ma- at at first there was some reduce in my weight. Then after that, I regain again my weight.
Okay, and also you are eating more than usual, you said.
Yes,
Okay. And can you tell me that have you noticed any changes in your weather preferences, like in hot or cold weather preferences?
I don't notice that.
Any lumps or bumps anywhere in your body?
No,
And any tummy pain?
no,
Yeah, okay. And have you noticed any changes in your water work?
no,
Any changes in your bowel?
no,
Have you noticed any black or red color stool?
no,
Do you have any pain in your joints?
no,
Any weakness at any side of your body?
no.
Okay. May I know that do you have any past medical condition that you would like to share?
As I told you, when I went to my GP, he said my blood pressure a little bit high.
And did he prescribe you any medication for that?
He start me on bisoprolol, but it doesn't help a lot.
Okay. And are you taking that medication regularly?
Yes,
Okay. And can you tell me that do you take any other over-the-counter medication?
I use for my headache some paracetamol. Otherwise, no.
And your headache is for how long?
It is like 15 minutes, 20 minutes,
And when did it start at first?
together with my palpitation.
Okay. And may I know that do you take any other medication except bisoprolol and paracetamol?
No,
Okay. Do you have any allergy to any medication?
no,
Okay. I am sorry to ask, but may I know that do you take any other recreational drug?
no, nothing in specific.
Okay, that's fine. May I know that do you know that any disease runs your family?
Disease, you mean? Yes, my father have ischemic heart disease, heart attack, and diabetes.
Any history of
And
cancer? Yes, please.
my mother has a history of cancer in her thyroid, in her gland.
And do you know that what was her diagnosis?
Exactly. They said there is cancer in
Okay,
her gland, neck gland.
okay, that is not a problem. And I am sorry for your mother. And may I know that how is she now?
She is fine. She did the surgery. She's fine.
Okay. And any history of date at early age in your family?
No.
10 minutes. Okay. And if you allow me, may I ask you a few personal questions?
Yes, sure.
Do you smoke?
Smoke?
Yes.
Yes, I was smoking like 10 cigarettes, but after the stress, I'm smoking more nowadays.
I'm sorry for that. And I would like to recommend you stop smoking because it is also related to your condition and smoking is injurious to health. And if you need help, I can refer you to the smoking cessation clinic. Is that okay for you?
Thank you.
And may I know that do you drink alcohol?
Yes, I drink. Also, I drink more nowadays.
And I can also I am recommending you to stopping alcohol consumption because it is also injurious to health. And if you need help, I can refer you to the alcohol cessation clinic.
Thank you.
May I know that what do you do for living?
I am accountant.
Okay. And is your condition affecting your job?
I have a lot of stress.
And for that, I can talk to the occupational health department and social care department. They can review your case and they can find a job that is suitable for you. Will it be okay for you?
Thank you.
May I know that do you drive?
Yes, I do.
And for that, I would also like to recommend you to stop driving until we are sure that what is happening with you.
Okay.
And may I know that whom do you live with?
I'm living with my wife.
And if you don't mind, may I know that do you think that you need any support at your home, at your social environment, or at any
No,
economic support?
no, thank you.
And I am going to ask you a few other questions. That have you noticed any changes in your face or any shoe size?
No,
Okay. Have you ever bumped into any object?
no.
Okay. And is it okay if I examine you now?
Okay, sure.
Okay, so I'd like to see your pulse.
110.
Okay, then I would like to ask you to stretch your arm and like to see the fine tremor is present or not.
There is some tremor.
Okay, and after that, I will like to see if there is any sweating over the palm.
There is sweating.
Okay, and then I may I know I would like to measure the blood pressure.
160, 110.
Okay, and at this point, I would like to see the eye movement. and
Okay.
also I for any proptosis, any lead lag,
No problem.
any
No
anemia,
proptosis. No.
anemia.
No anemia.
I would like to see the movements of the eye. Can you look at my finger and follow it without moving your head?
Moving all the range. No problem.
Okay, no complex ophthalmoplegia.
No.
Okay, and I would like to do the fundoscopy also for this gentleman.
No need.
Okay. And can you show me your tongue? I'd like to see your gum and palate if there is any hypertrophy or higher palate.
No. No.
Okay, and I'm going to see your neck. I'm going to see if there is any lumps.
No lump.
Okay, can you show me your tongue so that I will see if there is any movement of mass in the neck.
Okay.
Then can you take a sip of water into your mouth and hold it there until I tell you to swallow. Then I will
Okay.
see the movement of the thyroid gland.
Okay.
After that, I will auscultate the heart to see if there is any murmur.
Okay. Normal.
Then I will palpate the abdomen for any organomegaly, especially any suprarenal mass.
There is no organomegaly, but there is some tenderness happening.
Okay, I'm sorry for that. And at this point, can you stand up without using your arm?
No problem.
May I know that what is your concern?
Can I know what's going on?
As I have taken your history and I have examined you, I came with few differential diagnoses that it can be a problem with your thyroid gland that also your mother had. And there are also possibilities of other organ involvement, like some organ in your tummy. So that you are having this racing and pacing of your heart and also having headache. And for this, I will need to run some blood test and also some imaging test of your neck, of your tummy. And also I may need some imaging test of your brain. After that, I can be able to say you that exactly what is happening with you. Do you get me?
Is it a heart attack?
I am suspecting that it's not a heart attack, but it is due to the excessive working of the heart. That is most likely due to the overactivity of the thyroid, a gland in the neck.
Do I have a cancer?
I am not hiding you anything, but I am sorry to say that there is a possibility of having cancer.
Okay, doctor.
And I will review your medication also. Time up.
You said 18 minutes.
Yes.
So what is your differential?
Yeah, for this gentleman, my differentials are this is a case of paroxysmal tachycardia that can be due to hyperthyroidism, and I think the hyperthyroidism is also associated with Pheochromocytoma. So combinedly, I am suspecting that this can be a case of multiple endocrine neoplasia type 2.
Okay, what is other differential?
For this gentleman, I am also other differentials like he has anxiety at home, so that can provoke his palpitation. Then this can be due to coffee or tea drinking, though he has cut it down. Then it can be some other causes of familial or other congenital heart disease like Parkinson-White syndrome, then arrhythmogenic right ventricular dysplasia, then uh, hypertrophic obstructive cardiomyopathy.
What is your management plan?
Yeah.
Investigation.
For this gentleman, I will first go for the complete blood count to see anemia, and then white blood cell count level, then inflammatory markers. After that, I will go for the renal function test, liver function test, and random blood sugar level. And I will go for few specific investigations like serum TSH, free T3, free T4, serum calcitonin level, serum calcium level, and 24-hour urinary metanephrine. Then some imaging tests like ultrasonogram of the thyroid gland, ultrasonogram of the abdomen, then CT scan of the abdomen with special attention to the adrenal gland, then some other specific investigations like MIEG.
Are you going to do ECG?
Yes, I forgot to mention that I am going to go for the ECG and event recorder monitoring and 24-hour ECG monitoring and also echocardiogram and also chest X-ray.
Okay. The investigation showed ultrasound of the thyroid normal. There is no lump, no nodule, nothing suspected. So what is your differential now?
Even my differentials this can be a case of pheochromocytoma.
Okay, what are you going to manage him?
If it is a case of pheochromocytoma, then first I will educate and counseling the patient, then some non-pharmacological management like involvement of the occupational health therapist, occupational health department, and also advising him not to drive, then asking him to cut down alcohol consumption, smoking cessation, and coffee and tea consumption. And then I will involve the endocrinologist and surgical team and also oncologist.
Uh, what else?
I also review his medication as he is taking beta blocker. So I will involve the cardiologist and I will go for the alpha beta blocker, alpha and beta blocker like phenoxy. I forgot phenoxymethyl. I forgot the name actually. Phenoxybenzamine, I think.
Okay. Do you know his consumption of coffee and tea?
He said he cut it down, so I didn't go for that actually. But I should have asked about his current status.
Okay. Is it a hypoglycemia?
It can be a case of hypoglycemic attack, but he said that he doesn't feel hunger during the episode also, and there is no other signs of hypoglycemia, as he is not a case of non-diabetic, not taking any other anti-diabetic medication.
There is diabetes in the family, and you should ask if he check any blood sugar during that time.
Yes.
Okay. Why you want him to stop driving?
Yes, this is a case of this can be a case of pheochromocytoma, so there can be some palpitation and headache, and this is paroxysmal onset. So when driving, if he develops certain types of palpitation, that can goes into panic attack, and also he has history of getting panic attack, so that can affect his driving, and also it can suddenly develop into intracranial hemorrhage due to high blood pressure.
Are you sure about the DVLA regulation?
No, I am not sure, so I am asking him that until we are sure what is going with him, he should refrain himself from driving.
So what is the step of management after we add medication? And what do you suspect in the imaging?
For the imaging CT scan of the adrenal gland, there might be uh, s- uh, uh, increased size of the adrenal gland, that is, and also for ultrasonogram that can also detect increased size in the adrenal region. There is mass in the adrenal region. and there are some special investigations like MIPG that can detect the position of the uh, Pheochromocytoma.
So what is the is it treatable?
Yes, it is a treatable condition if it is not in advanced stage. So first going for the blood pressure regulation and surgical review, and after that removing removing the tumor is going to cure him.
Okay. What is mean to?
Okay, for men 2A and 2B, men 2A is associated with some tumor in the thyroid gland and some tumor in the that is called pancreas or other organs in the abdomen, like pheochromocytoma. Then can also present with Zollinger-Ellison syndrome, glucagonoma. Then for men to be, if it is associated with Marfanoid habitus, then we call it that men to be.
What is type of cancer of the thyroid?
It is uh, follicular type of cancer. I am not
So
quite sure.
medullary cancer in the thyroid,
Yes, medullary
uh,
cancer. Yes.
hy hyperparathyroidism, and pheochromocytoma. This 2A. The 2B it will be with malformed feature. Anything else? Okay, that's all for me. Do you want to add anything?
No, actually, first I got some puzzled after getting that it can be a case of totally pheochromocytoma, or it is associated with hyperthyroidism.
Well, what is in the history direct you to main one, main two? There is a history of thyroid in the mother, but there is no sign or symptom of hyperparathyroidism. There is no sign or symptom of cancer. There is no mass in the neck. There is nothing. No mass in the neck.
This
No
can
sign and symptom of hyperparathyroidism.
this can present without any palpable organomegaly, but it can be
Yeah, it is.
presented
It will be in the differential, but as second option. First option will be pheochromocytoma. Second option, main two. We should rule out any ischemic heart disease, any heart attack. It's important to mention in the differential. Hypoglycemia should be ruled out also,
yes.
and anxiety and stress in the job and consumption of tea and coffee. This is the differential.
Okay.
Any, anything else we can add?
No, I cannot remember much.
Hmm. Okay, thank you for very good performance.